Anemia is a condition that is caused by the lack of red blood cells in your body capable of carrying and distributing oxygen. Anemia has many forms with different levels of severity. Each form of anemia may arise from different symptoms, and anemia in itself may be a symptom for a more serious illness. Treatment vary depending on your symptoms. A healthier lifestyle may help in decreasing the chances of developing certain types of anemia. There are 5 types of anemia: sickle cell anemia, iron deficiency anemia, thalassemia, aplastic anemia, vitamin deficiency anemia.
Welcome to Simplified Health Tips, your place for factual information about achieving and maintaining optimal health. I'm Andrew. Today Michael and I will be covering everything you need to know about anemia, including its causes, symptoms and treatment options. So, tap the like button, smash that subscribe button and let's go. So Michael, what are the symptoms of anemia?
The following are symptoms of anemia. Take note that symptoms will vary depending on the type of anemia and the cause for said type. Weakness, abnormal heartbeat pattern, chest pain, respiratory problems, headaches, cold hands and feet, fatigue, pale or yellowish skin, shortness of breath. Symptoms for early-stage anemia will be mild to the point of not being noticeable. However, as the condition, anemia, worsens, these symptoms may become progress in severity.
Interesting. What are the causes of anemia?
Each type of anemia also has their own specific cause as follows. Hemolytic anemias. A group of anemias in which red blood cells are destroyed at a rate faster than what your body can produce. A result of a blood disease that causes blood cell destruction. Possible genetic or developed in later age groups. Anemias associated with bone marrow disease. Anemias under this type are caused by multiple diseases that affect the rate in which your body creates red blood cells. The difference between the hemolytic type of anemias and this type of anemias is the differentiating trait of red blood cell destruction found in hemolytic anemias compared to the low red blood cell production due to bone marrow diseases. Iron deficiency anemia. Caused by a lack of iron in the body, which results to a lack of hemoglobin, the protein that allows red blood cells to carry oxygen, in the body. Often caused by either pregnancy or blood loss. Anemia of vitamin deficiency. Vitamins such as folate and B12 are essential in the production of healthy red blood cells. A lack of these vitamins in the body will result in lessened red blood cell production. Sickle cell anemia. A genetic condition that causes an abnormality of the hemoglobin, causing premature death of red blood cells, causing a lack of red blood cells present in the body. Anemia of inflammation. A symptom of certain immune system related diseases that cause the body to produce a lowered red blood cell count. Aplastic anemia. This type of anemia is caused by certain medicines, autoimmune diseases, infections and exposure to harmful chemicals, resulting to a low red blood cell count.
Please tell us about the risk factors that may lead to anemia.
The following are factors that may cause anemia. Family history. Genetic factors may be inherited that may increase the likelihood of developing sickle cell anemia. Age. Older age groups are more at risk of developing anemia. Pregnancy. The strain of developing a child within your body may cause vitamin deficiencies, which may lead to anemia. Menstruation. The constant loss of blood caused by menstruation may cause an iron deficiency in the body. A lacking diet. Diets lacking vitamins, specifically B12 and folate, may increase risks of developing anemia. Other factors. Lifestyle, medication, blood diseases, infections, autoimmune disorders, exposure to chemicals, alcohol abuse may affect the rate your body produces red blood cell production. Intestinal disorders. Some disorders in the intestine might cause issues with the body's ability to absorb nutrients, which may put you in risk of anemia. Chronic conditions. Cancer, diabetes, kidney failure and the like may cause a decrease in red blood cell count.
What about complications? Are there any we should be aware of?
If symptoms persist and are left untreated, the following complications may occur. Death. Certain types of anemias may cause a potentially fatal amount of blood lost. Severe fatigue. The side effects of anemia may weaken your body to the point of being unable to do basic everyday tasks. Pregnancy complications. Expecting mothers with anemia may become more susceptible to giving birth prematurely. Heart problems. Due to the reduced red blood cell count in the body, the heart will attempt to pump out more blood to compensate. This may cause abnormal heartbeat patterns, and the strain this places on the heart may also cause swelling and heart failure.
What can be done in order to prevent developing anemia?
There are no preventive measures for most types of anemia. The only two types of preventable types of anemia are the iron deficiency type and the vitamin deficiency type. Here are the measures you can take to avoid contracting these types of anemia. Consume more vitamin B12 and vitamin C foods such as meat, dairy, citrus fruits, tomatoes, peppers, vegetables, soy products, fortified cereal, strawberries and melons are sources of vitamin B12 and vitamin C. Consume more iron and folate. Foods such as meat, vegetables, fruits, peanuts, grain products are rich sources for iron and folate.
Okay. So how is anemia diagnosed?
The following are the tests that your doctor may use to determine if you have anemia. Testing the blood cells for any abnormalities. Your doctor may collect a sample and examine your red blood cells for any abnormalities in size, color and shape. Complete blood count, CBC. This test is used to determine the concentration of blood cells within your blood. Your doctor will be looking at red blood cell levels and the hemoglobin in your blood, if he or she is testing for anemia.
What are the treatment options available for someone with anemia?
Anemia treatment depends on the cause. Iron deficiency anemia. The treatment for this type of anemia is through supplementing iron and consuming iron-rich food. Treatment for blood loss is also used if this is the cause for the iron deficiency. Anemia of chronic disease. For this diagnosis, your doctor will treat the disease causing the anemia or reduce the disease's severity. In extreme cases of this type of anemia, your doctor may do a blood transfusion or inject erythropoietin, a synthetic hormone, in order to increase your red blood cell count. Sickle cell anemia. For this treatment, your doctor will recommend the following to prevent complications: oxygen, oral fluids, intravenous fluids, pain relievers, folic acid supplementation, blood transfusion, hydroxyurea, antibiotics. Vitamin deficiency anemia. For this treatment, dietary changes are needed in order to ensure that you are intaking enough vitamin C and folic acid. If your body is having trouble absorbing vitamin B12, you will need to take shots of vitamin B12. The frequency and length for this treatment will depend on the severity of this condition. Thalassemia. Severe forms of thalassemia will require the following: medication, removal of spleen, blood and bone marrow stem cell transplant, blood transfusion, folic acid supplementation. Aplastic anemia. The treatment may require you to undergo a bone marrow transplant, in the case that your bone marrow is not functioning properly in terms of producing healthy red blood cells. May also include blood transfusion to increase your red blood cell count. Hemolytic anemia. Treatment for this type of anemia includes treating infections, medications that suppress the immune system, and avoid suspected medications that may be causing damage. Anemia is associated with bone marrow disease. The treatment for these diseases may include chemotherapy, medication and bone marrow transplant.
Thank you again, Michael, for helping our viewers fully understand anemia.
It's always a pleasure to share with the viewers and subscribers.
To our viewers, remember to share this video with someone who may benefit from the information. Also, leave your feedback and topic suggestions in the comments section. We appreciate your input and look forward to covering the topics you request. From all of us here at Simplified Health Tips, stay healthy and see you next time.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.